Hook. What if I told you that a small pain in your back, hip, or knee could actually be a silent infection slowly destroying your bones? Most people think tuberculosis only affects the lungs, but in the United States and around the world, tuberculosis can sometimes attack the bones and joints, causing chronic pain, disability, and even permanent damage if it goes untreated. The scary part is that many people ignore the early warning signs because they look like common arthritis, muscle strain, or simple aging. Today we're diving deep into bone tuberculosis, what it is, how it develops, warning signs you should never ignore, and the natural lifestyle habits that may support recovery alongside proper medical treatment. Stay with us because some of these symptoms may surprise you. Welcome back to Health Diagnosis. Tuberculosis, often called TB, is an infectious disease caused by a bacterium known as Mycobacterium tuberculosis. Most people associate TB with coughing, fever, and lung infections. However, the bacteria can travel through the bloodstream and settle in other parts of the body. When it affects the bones or joints, the condition is known as bone tuberculosis or skeletal tuberculosis. Bone tuberculosis is much less common than lung TB, but it can be extremely serious. The spine is the most frequently affected area, a condition known as spinal tuberculosis or Pott's disease. Other commonly affected areas include the hips, knees, ankles, shoulders, and wrists. One reason bone TB is so dangerous is that it develops slowly. Unlike a sudden injury, symptoms may take months or even years to become severe. During this time, the infection can gradually destroy bone tissue, weaken joints, and affect mobility. Let's understand how this disease develops. When someone becomes infected with tuberculosis bacteria, the germs usually enter through the lungs. In some individuals, especially those with weakened immune systems, the bacteria can spread through the blood circulation. These bacteria may remain dormant for years. Later, if the immune system weakens, they can become active and begin multiplying in the bones. This slow progression is why many patients don't realize they have bone tuberculosis until significant damage has already occurred. One of the earliest symptoms is persistent pain. Unlike normal muscle soreness that improves with rest, bone TB pain often becomes worse over time. The discomfort may be dull and aching initially but gradually intensifies. People with spinal tuberculosis often experience chronic back pain. Many assume it is caused by poor posture, aging, or a slipped disc. Unfortunately, the real cause may be an ongoing infection damaging the vertebrae. Another common symptom is stiffness. Patients may notice reduced flexibility in the affected joint. Activities that were once easy become increasingly difficult. Swelling is another warning sign. The affected area may become enlarged and tender. In some cases, cold abscesses can develop. These are collections of pus that form without the typical redness and warmth seen in ordinary infections. As the disease progresses, movement becomes more difficult. Walking, climbing stairs, lifting objects, or even standing for long periods may become painful. Many patients also experience general symptoms associated with tuberculosis. These include fatigue, weakness, low-grade fever, night sweats, and unexplained weight loss. Because these symptoms are often subtle, diagnosis is frequently delayed. Who is most at risk? People with weakened immune systems are more vulnerable. This includes individuals living with HIV, those receiving chemotherapy, transplant recipients, and people taking long-term immune-suppressing medications. Diabetes can also increase the risk. Poor blood sugar control weakens the body's natural defenses against infections. Malnutrition is another important factor. When the body lacks essential nutrients, the immune system struggles to fight infections effectively. Older adults may face a higher risk because immunity naturally declines with age. Individuals who have previously had tuberculosis are also more likely to develop bone TB later in life if dormant bacteria reactivate. Let's talk about diagnosis. Doctors typically begin with a medical history and physical examination. Imaging tests such as X-rays, CT scans, and MRI scans help identify bone destruction and joint involvement. Blood tests may show signs of inflammation but cannot confirm bone tuberculosis on their own. In many cases, a biopsy is required. A small tissue sample is taken from the affected area and analyzed for tuberculosis bacteria. Early diagnosis is extremely important because prompt treatment can prevent permanent disability. Now let's address a common question. Can natural remedies cure bone tuberculosis? The simple answer is no. Bone tuberculosis is a bacterial infection that requires proper medical treatment. Antibiotic medications specifically designed for tuberculosis are essential. Without appropriate treatment, the infection can continue damaging bones and joints. However, natural lifestyle measures may help support the immune system, improve overall health, and assist recovery while following medical advice. Let's discuss these supportive natural approaches. Nutrition plays a critical role. The immune system requires adequate protein to repair damaged tissues and produce immune cells. Good sources include fish, chicken, eggs, beans, lentils, and Greek yogurt. Vitamin D is especially important for bone health. Low vitamin D levels have been linked to impaired immune function and weaker bones. Safe sunlight exposure can help the body produce vitamin D naturally. Fatty fish, fortified dairy products, and eggs can also contribute. Calcium supports strong bones during recovery. Dairy products, leafy green vegetables, almonds, and fortified foods are useful sources. Vitamin C helps support immune function and collagen production. Citrus fruits, strawberries, kiwi, bell peppers, and broccoli are excellent options. Zinc is another important nutrient. It supports immune responses and wound healing. Foods rich in zinc include meat, seafood, pumpkin seeds, nuts, and legumes. Hydration should not be overlooked. Drinking adequate water helps support overall health and may reduce fatigue. Let's discuss the role of exercise. Physical activity should always be guided by healthcare professionals, especially if the spine or major joints are involved. Gentle movement can help preserve mobility and prevent stiffness. Physical therapy is often recommended to improve strength and function. However, excessive activity may worsen damage and weaken bones. Therefore, exercise programs should be individualized. Sleep is another crucial factor. During sleep, the body performs important repair processes. Chronic sleep deprivation can weaken immunity and slow recovery. Adults should generally aim for 7 to 9 hours of quality sleep each night. Stress management may also be beneficial. Long-term stress can negatively affect immune function. Techniques such as meditation, deep breathing, mindfulness, and gentle yoga may help reduce stress levels. Some people ask about herbal remedies. Various herbs have been studied for their anti-inflammatory or immune-supporting properties. Examples include turmeric, ginger, garlic, and green tea. Turmeric contains curcumin, a compound known for anti-inflammatory effects. Ginger may help reduce inflammation and support overall wellness. Garlic contains compounds with antimicrobial properties. Green tea provides antioxidants that support general health. While these foods may be healthy additions to a balanced diet, they should never replace prescribed tuberculosis treatment. A dangerous misconception is that natural remedies alone can eliminate bone TB. Unfortunately, this belief can delay life-saving medical care. Let's discuss possible complications if bone tuberculosis is ignored. In spinal tuberculosis, vertebrae can collapse, leading to deformities such as kyphosis, commonly known as a hunchback appearance. The spinal cord may become compressed, causing numbness, weakness, or even paralysis. Joint destruction can occur when TB affects the hips, knees, or other joints. Severe damage may result in chronic pain and disability. Abscess formation is another complication. These collections of infected material can spread into nearby tissues. Delayed treatment may require surgery to stabilize bones or remove damaged tissue. The good news is that modern treatment is highly effective when started early. Most patients receive a combination of anti-tuberculosis medications for several months. Treatment duration is often longer than that used for ordinary bacterial infections because TB bacteria grow slowly. Regular follow-up appointments are essential. Doctors monitor treatment response and adjust therapy if necessary. Many patients recover successfully and regain normal function when treatment begins before severe damage occurs. Let's review some warning signs that deserve medical attention. Persistent back pain lasting weeks or months. Unexplained joint swelling. Pain that gradually worsens instead of improving. Difficulty walking or moving normally. Unexplained weight loss. Night sweats. Persistent fatigue. History of tuberculosis combined with new bone or joint symptoms. If you experience these symptoms, seeking medical evaluation early can make a significant difference. There are also steps people can take to reduce their overall risk. Maintain a nutritious diet rich in protein, vitamins, and minerals. Control chronic conditions such as diabetes. Avoid smoking, which can weaken immune defenses. Stay physically active within safe limits. Get adequate sleep. Follow medical advice if you have been exposed to tuberculosis. Remember that prevention and early detection are powerful tools. Bone tuberculosis may be less common than lung TB, but its consequences can be severe. Chronic pain, disability, and permanent bone damage can occur when diagnosis is delayed. Understanding the symptoms and seeking timely medical care can help prevent complications. Natural health practices such as balanced nutrition, adequate sleep, stress management, and gentle physical activity can support the body's recovery process. However, they should always complement, not replace, proper medical treatment. If you found this information helpful, make sure to like this video, share it with friends and family, and subscribe to Health Diagnosis for more evidence-based health content designed to help you make informed decisions about your well-being. Thank you for watching, and we'll see you in the next video.